Welcome to the BFIT Blueprint podcast. We are your hosts, Cody Israel and Brad Durham. For all you BFIT members and beyond, this is where we break down the blueprint of building a healthier, stronger you. In every episode, we share actionable tips, expert advice, and real stories to inspire you to level up your mind, body, and lifestyle. Whether you are just taking your first step or pushing for the next breakthrough, we've got the tools to get you there.
What is up, BFIT? Welcome back to the BFIT Blueprint. This is episode 3 of season 3 of the new year, and we have a returning guest. All right, this episode we have Dr. Lindsay Rice back again to talk about testosterone replacement therapy. Last time she was on, we talked about hormone replacement therapy. So we're going to go another route and talk about that. So, Lindsay, if you want to reintroduce yourself for any listeners that didn't listen to the last one.
Yeah. My name's Lindsay Rice. I'm a board-certified family medicine physician, and I've been working out here at BFIT for, 8 years now, something like that.
Somewhere around there, because you've been with me for at least 5.
Yep.
So, okay, so we'll go ahead and just jump right in. So I guess first thing to start off is, what is testosterone replacement therapy?
Sure. So to kind of set the scene, the last time I was here, we spoke a lot about women. The majority of that podcast was on hormone therapy in women. This time we had several people around here that wanted a show focused mainly on the men's aspect.
Yeah.
And so, like I said before, men are simpler, women are more complex. And so when we talk about just testosterone replacement, that's what we're talking about when we talk about TRT is for men specifically.
Yep. All right. So how does it differ from natural testosterone? Does it differ?
Technically, yes. It is not exactly the same when we're making testosterone in the lab, but it is the same structure. But we have to put it in a formulation that keeps it on shelf stable and things along that line.
Awesome. So what are the main things you look at in someone who comes to you and asks about testosterone replacement therapy?
Sure. This is a conversation I've been having a lot more recently, just because testosterone is more and more prevalent in society. And some of the misconceptions and stuff are starting to finally change. But what I'm looking for when a man comes to me with concerns is a lot of times his concerns are going to be, I'm more tired than I used to be. My sleep has gone terrible. I've been hitting the gym and I don't feel like I'm getting anywhere.
Yeah.
My anxiety is worse, like things where it's similar to women. And then they'll come to me and just say, well, I don't feel right.
I don't feel the way I used to feel.
I don't feel the way I used to feel. And there is some, we do get older.
I was going to ask that, the natural, aging process.
Yeah.
Part of that, I would say, is somewhat normal.
But there is a way that by watching this, you can say, okay, yes, I'm getting older, but I'm going to do so a little more gracefully than just falling off a cliff.
Yeah. Yeah. So kind of just lifestyle things, come into play. So I guess you've been seeing more of this happening, Do you think there's any other factors as to why, that's happening more?
So in men, your testosterone is going to peak around your early 20s. And there is a certain decline that happens naturally over time.
Yeah.
But I am seeing men in their 20s and 30s with exceptionally low testosterone levels. And I've never seen that before in the last 15 years. And so I think a lot of it has to be just like all the other new problems that I'm seeing in the office. It has to be lifestyle and environmental.
Yeah.
And it has to be that, the main things that are important, the way we eat, the way we move our bodies, the way we sleep, our personal relationships, we're seeing those deteriorate. And then this is just, again, a symptom of that.
Yeah. Yeah. But I think
for a lot of people, not everybody. But
Yeah. But I think, the farther we get in this life with technology and everything coming up, that's a different conversation, but I think we'll see. I don't think this issue is going away anytime soon.
It's not. It's not. But it all comes back to the basics.
Yep.
Always comes back to the basics.
So going along with that. So fixing those things first or looking at those things first is the first route, right? Is the number one.
That is my preference. But a lot of times what I run into is I say, okay, we need to fix these things.
Yeah.
But sometimes we look at fixing those things in addition to maybe managing with some testosterone, because it will be hard to work all day at work and then have the energy to come home and at night and get that good sleep or get that exercise, because your sleep can be affected by low testosterone.
Oh, yeah.
And so if your sleep's garbage, it is really hard to get better sleep.
Yeah. Yeah. So, what levels of testosterone are considered low? Because I'm sure that'll be a common question and people may not know.
Yeah. So there's a couple of different ways to look at it. Technically, when you're looking at, following the guidelines, 300 and below is generally considered to be problematic. And across the board, I don't know of any man that I've ever checked and their testosterone was under 300 where they're like, yeah, I feel great.
Yeah.
That doesn't happen. But then the difference is finding what the absolute low is, and then also finding, well, where do you feel best? Because it is a long way from 300 to 1,000. And do I feel better at 700? Do I feel better at 900? Do I feel fine at 500?
And that's all like a normal range, right?
That's all normal range. But there is a difference between what's normal and what feels, ideal, I guess.
And that's why, I've heard this said to me before. I've heard it on a podcast or something, and I, wish I would have had mine tested previously, because, someone, now tell me if I'm wrong, but like someone who is, normally their average is normally like 800, but then all of a sudden they're like 400 to 500, which is still considered, quote, normal.
Well, normal, but it doesn't feel good to them anymore.
And then they go to, a doctor.
And they're told their levels are normal. Yeah.
Yeah. And then I guess that's where the symptoms and everything you have to take into account for those, right?
You have to take that into account. And the other factor, unfortunately, that, I have to take into account is affordability for options, because, traditionally patients are coming in with health insurance, and their health insurance will not cover replacement if that is over 300.
Oh, so it has to be under in order for
them.
Justification.
Now that doesn't mean you can't do it.
Yeah.
But you have to kind of think about the financial structure, which is annoying.
Interesting. Now, how much? Now, I don't know if you know that. Just that rate, like a clinic, if you weren't able to go through, like an insurance, what is like an average monthly cost?
Kind of depends on what you go with. So, and there's different kinds of ways to supplement testosterone, and it can be anywhere. On average, I think you're looking at probably $100 to $200 a month, depending upon what you do. There are some more expensive options, and there are some cheaper options.
What are the different ways of taking testosterone?
Sure. Technically, you can do injections, and you can do injections a couple of different ways. You can do an intramuscular injection once a week, so that's the long needle.
Oh,
yeah.
You
can do sub-Q injection, so you're putting it like on the abdomen or on the thigh.
Fat.
Yeah, for men, I usually will do that 2 or 3 times a week. And then
those are the tiny needles.
Those
right?
are the tiny needles.
Okay.
Those are the half inchers. And then there is testosterone gel or cream, and you're putting this stuff on every day.
I haven't even heard of that.
Yeah, that's you've heard of it. You just don't realize that you have. Yeah. And then
is that as effective as the?
For a lot of men, it is. I have found that there are some men that absorb really, really well, and some that do not. But I have.
I know the skin absorbs, but I guess I just would have never thought that it does as well as straight into your body.
Yeah, you have to, and there's also risk versus benefits for different kinds, and why you would choose different kinds. Technically, there is now an oral testosterone.
That was my next question is there like a pill form or something?
There is. It is relatively new at this point, definitely pricier than the other options. And the bioavailability of it tends to be a little bit less, because it has to go through your liver and then out into society. Okay. Whereas if you do transdermally or injectables, that's right into the tissues.
Do you think they'll ever get to the point where, I know a lot of things like absorb very well, like under the tongue, like where they have like.
Well, I've actually used testosterone. I've prescribed it before as a buckle. You just put this little gummy in your cheek and let it absorb. And it does not seem to work quite as well. Again, you're dealing with whether or not you're going to absorb all that through the cheek, which is the fastest way to get it in, but you're also swallowing some of it and then it goes through your system. So it doesn't work quite as well.
Okay. So it degrades a little bit more.
It does.
Okay. All right. So we kind of talked about how people feel before they get on testosterone. What can people expect to feel after they get off testosterone?
So that, again, is relative. But what I'm looking to see when I'm talking to guys about TRT is an improvement in whatever their symptoms were. So you come to me and you say, I'm tired all the time. My sleep is garbage. My mood is, I'm grumpier than I used to be. Sexual dysfunction could be part of it, not necessarily the only thing.
Yeah.
And what I expect is I'm expecting to see a percentage better of that. I expect them to come in and say, I am sleeping better. I am going to the gym. I have more energy. At the end of the day, I have the energy to still play with the kids and help with the kitchen and then get everybody to bed. I'm not just collapsing when I get home.
How long, after someone starts testosterone replacement therapy, how long does it take for them to start to feel the effects?
Sure. It can be relatively quickly within a couple of weeks, but I usually tell men we're looking at 3 to 4 months to figure out where that sweet spot is. And that also then goes into, it's not a one size fits all.
Oh, yeah. Like how often whenever you start someone, do you have to adjust either up or down?
Sure. So what I'm doing most of the time is trying to get someone started, and we're looking at levels somewhere between 4 to 12 weeks and symptoms between 4 to 12 weeks. And we're looking for that, this is an adequate time frame to see that we've got some improvement. How does your body respond? Are you a good absorber? If we did transdermal, do we need to switch how we're doing your injectables?
I guess I would think of that. Like if one's not working, you can switch up the method.
Switch up the other. Yeah. And so I do that. And then once we kind of find, yep, this is kind of that sweet spot, this is working well, I'm checking in with guys about every 6 months. If we get real sturdy on it, then maybe once a year, but at least once a year, if not every 6 months.
So whenever, if someone you put them on a dose and they're not necessarily responding, do you first up the dose of that method, or do you switch methods of taking it?
It depends on their response.
Okay.
So if we do the lab and it's like, wow, your testosterone is doubled and you just don't feel any better, then that's probably not the testosterone that's the main problem.
Yeah.
Then we have to really dial down into, are you doom scrolling on your phone at night when you're supposed to be going to sleep?
Yeah.
What are you having for dinner? Are you getting enough protein in your day? How's your gut health?
Are you exercising? Are you exercising too much? All of these stress factors and everything like that affects your testosterone number.
It does.
So when someone gets on testosterone, how long are they on it for, ever? Can they come off of it? How long?
Both are options.
Both are options.
Both are options, but the majority of men, because we're talking about starting testosterone replacement, and the majority of men we're starting in midlife, 40s, 50s, 60s. And so if you come off of it, your testosterone will go back to where we started. And if you're a little guy and that's okay with you, that's fine. But again, when we're dealing with trying to age well, we want to maintain our muscle mass, and you want to be that ripped grandpa at 80 years old with all that muscle mass, because that muscle mass is going to help protect you from the bad things. It protects you from the falls. It protects you from the heart disease. It protects you from all the things.
Yeah.
And when the testosterone decreases, your muscle mass decreases, and you can't out gym it.
Nope. We talked about the benefits of muscle a lot on this podcast.
Yes.
Okay. So when someone's on it, what are like the main, minor, major, what are the main risks or side effects of it?
So that is part of the reason I'm adamant that we kind of approach this evidence-based with how we do things, because you can do some really bad things with testosterone if you're not careful. It can make sleep apnea worse.
Oh.
So if you have sleep apnea, it needs to be well managed. If you're at risk for sleep apnea, you need to get screened for it before you start testosterone.
Oh.
Sleep apnea does bad things to your body, so you need to make sure we're not making that problem worse. It can cause what we call erythrocytosis. It can make essentially your blood too thick, is the way I explain it to patients. But your hemoglobin and hematocrit can go up, which it can go up a little bit and it's no big deal.
Yeah.
But if it gets above a certain level, there's a risk for some clotting problems. And again,
so thick.
Yes. And I really am not in the business of giving people strokes. It's not what I want to do.
It's not a good business to be in.
Not a good business to be in. It affects fertility. So when I'm talking to these younger guys, we are doing a lot of counseling about, well, where's your family situation at? Because while it's not a good form of birth control, you cannot count on it for that. It drastically reduces spermatogenesis. And again, I am not in the business of ruining families. So you have to talk about that. There are ways around that, but they are complicated and involved.
Okay. I didn't know that there was ways around that.
Yeah, there are, but it involves taking more stuff.
That's what I was going to say. Is there something you take to essentially counteract that?
Yeah, you can run your dosages a little different when you kind of have that in mind. But really on my younger guys that don't have complete families, we are really talking about the other ways to manage low testosterone,
So,
not replacement.
like, on piggybacking off that, so if you get on it, and then say someone it is like a younger person, they get on it, and then they want to have kids, can they get off and still?
They can, but there's still that chance that it won't come back to the same degree. And so is it a huge, I mean, is it like an 80% chance that it won't come back? No. But anytime you go messing with someone's fertility, they need to understand what the risks and benefits are with that.
Okay.
So
that I think that's probably a big factor in this, especially like you were talking, you're seeing more and more younger folks.
Yeah, I have 20 and 30-year-old guys with, numbers that I'm like, wow, this is low. But you just got married. No, I'm not going to do that.
To you.
Yeah. I'm not doing that.
Yeah. Okay. So you said they should be monitored, usually monitored, every 6 months. And then once they've been on it for a while, back that up to a year.
Yeah.
So what are the differences? Is there any key differences because I know we talked a little bit about women on TRT, the key differences between men and women on TRT, like obviously the dosage, but it still affects, in a similar way, right?
Yeah. So really the main difference is just the dosage. A woman is taking 1/10 of the dose that a man would.
So we have a normal for men. I don't remember if we talked about this on the last podcast. What is a normal for women?
Normal for women, again, it's going to be where she feels better. But, technically when we look at a lab, the normals are going to say something like 4 to 40, and none of that would feel good.
Yeah.
Most women are going to feel better somewhere between 50 and 100.
Really? Okay,
yes.
I see it, and I didn't know that. I didn't know it was that high. I thought it was low.
Yeah. No, if you have an 8, you don't feel
You're not going to feel very good.
No.
Going back to ways it can be administered, I'd heard this method before. Some members at the gym, pellets.
Yeah. So pellets are another option. And the problem I have with pellets is that you are putting in these tiny little pellets. And for men, you put in a lot of them. Okay. You put in like 3 rows of these things.
You just like inject them in.
And they live underneath in the subcutaneous tissue until they dissolve. And the theory is that every time your heart pumps, you have these down in those capillary beds and it just pulls away a little medicine. The problem with that is it is not as steady state as the pellet companies would have you believe. So I will see guys that have done pellets get really, really high right away. And, they come back for their checks and they are
raging
15 or 1600. I've seen that one firsthand. It's not a lot of fun. So I don't think there is as much management that you can, you put them in there and then you're stuck with those.
It's not like you can go back in. I mean,
they don't come out.
I was gonna say you can't just go take them back out.
And you're looking at 3 to 6 months of that. So you can't back off of it. And then when they plummet, when they're done, they just
fall off the lift.
So pellets, they work for some people, but they are no longer.
And you probably can't
and they're expensive.
You probably can't pinpoint when you're going to run out. It probably just kind of happens.
It just kind of
and then you can't, it's like you just have another one ready. I could see how that would be kind of.
And again, for some people, they work fine. But I think there's just better ways of doing it.
Yeah, easier ways to monitor and manage it.
Yes.
Keep you steady
rather than crossing your fingers.
Yeah, and just hoping it works.
Yeah.
Okay. So I'm sure there are some out there. I don't know. I can't name any off the top of my head. What are the big myths about testosterone replacement therapy?
I think a lot of it comes from, people, when you say, oh, I'm on TRT, they equate that with being on gear or being on anabolic steroids.
Yeah.
And the dosages. And, I've listened to some guys talk about when they were doing anabolics and they're shooting for ranges around like 2000, 1800. That's not what we're doing. With TRT, what we are doing is just reestablishing back to a physiologic level.
Yeah, like a therapeutic dose.
A therapeutic dose. I'm not turning you into Arnold Schwarzenegger. That's not the goal because there are some really big problems with guys that are on doses like that. Just like everything, too much is not a good thing. And so there are some complications that can happen when your levels start to get that high. That's not the goal. The goal is to make you feel better, but not to turn you into someone else that you're not.
Yeah. There's other ways you can do that.
Yeah.
That are more effective, probably.
Probably, yes.
Wouldn't recommend them, but.
Yeah.
So you would say that TRT, like the understanding of it has slowly do you think it's trending in that direction though? Do you think like the understanding of it is, or maybe just people are like becoming more aware of, how important health and longevity is, that they're like going down this route more?
I see two things happening. One, yes, I think that we're talking about it more and more because, I mean, even when I was in residency, that was kind of newer. It's been a long time.
Yeah.
It was newer to do that. And there were still doctors that's like, I don't believe in that. Like, as a doctor, you don't really get to say you believe in a hormone or you don't. Like, there's ways you need to educate yourself about the best way to do it. And if you don't have a passion for it, that's fine. But you need to be able to offer someone else.
Yeah. Refer out.
Find somebody that will do those sorts of things because patients are going to come to you with those questions. The other thing that I have seen though, and the trend that I don't like is that it's now been monetized and we have all these influencers talking about it, and you can go to 13 different T clinics in the Kansas City area. They will slap you on these doses, no follow-up. They're not checking the blood work. They're not, talking to you about fertility. They're not talking to you about cardiovascular risk, prostate risk, like they're not doing this. They're just
trying to get a paycheck.
They're just trying to get a paycheck. And that bothers.
That is the major downside of it.
Yeah.
Okay. Now, is it the same with HRT too? Like for women, hormone, is that becoming more prevalent?
It is.
Space as well?
It is. Yeah. And that's where a lot of your pellet clinics come from or these wellness clinics, which if they are done right, I have no problem with them whatsoever because there aren't enough of us that like to do this that are offering it.
Yeah.
But when it is just done from that, this is a business and we're here to make money and we're rushing people through here, that bothers me.
And then if someone goes to them like looking for actual help and they go there and to get one time and they have a bad experience, they're probably never going to try another clinic again.
And going and knowing with the counseling that maybe we try topicals because you're like, I really am never going to give myself a shot. Okay. So we try the topicals. That doesn't work well for you. Okay. Well, we have these other options. Like we can adjust.
Yeah.
Oh, your dose got too high. Well, let's just back off on your dose. It's not that you failed TRT.
Yeah.
It's that you maybe just don't have the right dose or the right way that we're giving it to you, or hey, let's look at your diet a little bit. Like
look at these other ways.
Yes, a pizza roll is not a dinner.
Yeah.
Or let's look at your other habits. And so you have to that takes time and that takes conversation and that takes relationships and it is not a meat market.
Yeah. So if we were to give people, I don't want to say, I'll use the word guidelines, quote unquote guidelines for like natural ways, lifestyle ways, changes to naturally boost their testosterone. Like we could, give like a rank, like what would be the key pillars of that?
Sleep, nutrition, and strength training.
Yep.
So if you get good sleep and have good hygiene to maintain that, that is probably one of the bigger things to help your testosterone.
Yeah.
But if you're staying up late or you're drinking before you go to bed or you do other things that affect the quality of your sleep, your testosterone will suffer.
Yeah.
Same thing. Yeah.
Well, I was saying, like, we've talked about sleep before, and like, you might feel like you're getting good sleep on like 5 hours, you might be sleeping enough to, recover for the next day, but for like long term, like especially how that affects your numbers, that's probably not doing you any favors.
Yeah. It's just not helping.
Yeah.
Right?
You probably want to, at a minimum, shoot for at least 6 hours. Ideally, probably like 7 to 8, 9 would be even better.
Be great. And that's not easy to do, particularly, the majority of the men that I'm talking to, they're in midlife. They have kids on 15 different ball teams. They're trying to, they're pretty far in their careers at this point. They've got stresses from that. And so, but sleep has to be important.
Yeah. Yeah.
We build muscle mass. You're going to increase your body's natural testosterone.
Yeah.
And then if you have a good, varied diet, adequate protein, adequate fiber, eat your fruits and your vegetables, drink your water. Don't come to my office and tell me you just don't like water because I will call you a bad human.
I've heard that before. It's like, I don't like the flavor of water.
I don't care. Like, be a man, drink your water.
Yep.
So, you have to do those things because if you don't, I can supplement your testosterone and I can help with that, but we're still not going to be seeing you being the ideal human you want to be. And it is just a tool. It is not the answer.
And all be all. Even when you get on testosterone, I think you need to still be doing all of these things. We've talked about probably every podcast we've mentioned the benefits of all of these things, and they all work synergistically together. Like sleeping more is going to help you build more muscle. It's going to help you feel better throughout the day and move more. It's going to make you probably want to eat better. All of these things lean into one another, which all of those things is going to help your testosterone naturally go up on its own.
Yeah. So it requires work, and you do have to think about it.
Mhm.
It's not magical, and we have all this convenience surrounding our existences.
Mhm.
But you do that meal prep on Sunday, just like you do,
Yep.
Cody.
Yep.
You set things up that we have these things to where we can make it more convenient, but we're not just grabbing trash and trying to turn trash into something that it's not.
And I think that, and yes, it takes a little bit of work. I will say it's very simple. It's not like easy, but it's very simple to, do.
Yeah.
It just, like you said, takes planning, takes just a little bit of time. We talked about meal prep before. It takes 2 hours out of the weekend to prep your lunches for the week. And if you want to get crazy, it takes 4 hours out of the weekend to prep your lunches and dinners.
Yeah. And I would say mine takes less than that, but mine is simpler than yours.
Well, yeah. That's probably like the most it would.
Yeah, that's the most it would take. And, that's one of the things I do after we work out on Mondays is I will stick chicken in the oven. I will get my beans ready. I will get my vegetables ready. And that's it.
Yeah.
It's not complicated.
Yeah. And then coming back to like exercise, we've talked about it before. You think if you strength train at a minimum 2 times a week,
30 minutes to an hour.
Yeah. 30 minutes, 60 minutes. That's sufficient as long as you're doing, the main compound lifts. You're doing some type of squat, some type of deadlift or pull, a press. And then the other days you're walking, you're getting some steps in, getting 8,000 steps a day, getting some sunlight. Like, you're hitting the big pillars there.
Yeah. And that's just part of being a healthy human.
Mm-hmm.
And that's with the testosterone, that's the same concept. I'm not turning you into Arnold Schwarzenegger.
Yeah.
I want you just to be active and feel good and be able to do the things you want to do for as long as you want to. You want to be 70, 80, 90 years old and still be able to be the active person you want to be.
All of these things are part of just being a normal human, which might seem not as normal these days with all of the cell phones and social media and technology. It seems like it's getting harder and harder for people to be a quote unquote normal, functioning human.
Let's be a human. Let's be active. So the other thing we haven't talked about too are some of the controversies regarding testosterone as far as from a medical standpoint. And that is because we just didn't have really good research in those areas. And the main ones that we talk about, cardiovascular disease. So for a very long time, it was questionable whether or not TRT was going to make cardiovascular disease worse or increase risks there. Because all we had were just observational small studies. We didn't have a lot of good data. In the last couple of years, this big study called the Traverse trial came out. It was a big study, like thousands of men, which was the first time that specifically type of study was done. And it actually showed a benefit to maintaining a normal-ish testosterone level. And so now we have good data that says, no, this is actually, when you talk about risk versus benefits, this is this is an option and does not increase your risk of cardiovascular disease.
Well, I would think, if you're doing a therapeutic dose, if you're doing it for health reasons, it's going to help your sleep. It's going to help, you're going to feel better. So again, we talked about that helps you in every other facet of your life as well. So in theory, it's going to be quote unquote healthier for you.
Yeah, healthier for you. And then we also now have good data too that testosterone doesn't cause prostate cancer. That was a common fear for a long time. Now, I would never give testosterone to a man that is actively being treated for prostate cancer because similar to estrogen and breast cancer, where I said, it doesn't cause breast cancer, but it can feed it. Same thing. So if you have prostate cancer, testosterone feeds it. That's why the majority of our treatments are anti-androgen, which is hard. So being a guy being treated for prostate cancer when you're doing the anti-androgens is not fun. But even, once you're a couple years out from your cancer, you can have a discussion with your cancer doctor, with your urologist, with your TRT doc to come up with
what it looks like.
What that looks like.
Do you think, well, this kind of goes back to what you were talking about with the clinics that are just popping up all over the place. Do you think TRT is overprescribed?
Sometimes. Yeah, I think it's very easily overprescribed if you're not asking the right questions, and you are not talking about all the things that we always talk about
Yeah.
around here, right? I think that it is sold to, well, this is just going to fix all your problems.
Yeah.
And in that setting, I don't like it. But I also am seeing lower and lower numbers in younger and younger men. And with those numbers, and I have these guys that come in and say, I don't feel good.
Yeah.
I think there's still probably more men than we realize that are struggling with it, because it's not like you guys are very good at asking for help.
Well, I don't know, shock value.
Yeah.
So going along those lines, how often do you think, or when should someone start having their testosterone checked, and how often should they have those numbers checked?
Yeah. So this is where it gets controversial, even with me trying to figure out what's the best thing to do. Technically, if you are looking at the guidelines of medicine, and medicine sometimes is not at the forefront of things because we're anxious people, really you don't ever screen for testosterone. You don't say, oh, what's your baseline level? I'm not going to check a kid's testosterone at 19 just to know what his baseline is. Like, that just isn't really in medical practice. But when you have a guy that comes in complaining of those symptoms, those vague fatigue, body aches, poor sleep, then I think you should be looking at that.
Yeah.
Just to see if that's one thing you can do to help.
Mm-hmm.
But there isn't really a, hey, at this age, go get your testosterone checked.
Okay.
There isn't a strict, solid guideline there. Yeah.
Because you're only, the numbers are just a tool.
The numbers are just a tool.
Okay.
Yeah.
Is there anything new or coming up in the TRT world that is going to like change the game, or just any
I'm interested to see what the delivery method. So now we have the oral option, and I'm interested to see with over time if that will pick up and take off.
Yeah.
It is the current medication is kind of cumbersome. You have to take it at certain times. It's multiple times per day. It's multiple pills. And so that part is interesting to me. And then looking at different ways that we're following guys along, and kind of, are we going to kind of see a shift in what we consider the normal values? Are we going to see a shift in guys saying, well, I probably was 800 before, now I'm 400. Talking to men a little bit more about, hey, your insurance doesn't care about this, but I still care about this. And these are the options that we have, just to try it and see.
I wonder if, that, if the pill ends up being like super, it works as well as like injections. I wonder if that at that point, those same clinics that are just like, here you go, dishing it out. Like, I wonder at that point, will it get like out of control?
Yeah. Because the problem is on a lot of that stuff, and all of the supplements that go along with that, there's no regulation on. And so that it's very easy for that to happen.
Yeah.
But the problem is that we as doctors are also doing our patients a disservice in not talking about it, or not, opening it up for conversation.
Yeah.
Because I know up until the last 5 years, I wasn't good at bringing this up with guys.
Yeah.
But again, as my husband and I have both gotten older, new things of, you kind of learn about things and say, oh, I'm sorry.
Yeah.
Let's learn about something new.
So you would say, someone listens, a guy listening to this that's going to go to a clinic, no matter where they go, at least I would say, ask questions. Like ask whoever's prescribing it questions versus just letting them give you whatever. Ask questions about like, are there any side effects? Tell them all about yourself and see if they give you any feedback, or if they're just like pushing it on you.
And I think sometimes a good way to figure out is asking the right kind of questions. So asking a lot about the things that make me nervous as a physician.
Yeah.
So asking about, well, how are you going to monitor me for my hemoglobin and hematocrit? How are you going to manage it if this gets too high? Because the TRT clinic isn't going to be able to say, oh, well, I'm going to send you over to the hospital. You're going to go and have phlebotomy. We're going to go donate blood. They don't have the tools to get you set up for those sorts of things. So being in a place that's comprehensive and says, oh, yeah, this is what we need to do, or going to a place where they are talking to you about the things that we talk about here and not just trying to sell you something, that can be helpful.
Yeah.
From my perspective, and yes, I operate in a hospital system, and I operate in a system that, insurance dictates a lot of what we can do, and that has its frustrations. But whether or not you decide to do TRT or not has no effect on my bottom line.
Yeah.
Like that's not why I'm doing it. And that at least makes me feel a little more comfortable with it, I guess. You know, doctors really are not out there to hurt you. They're not out there to just steal all your money. We really just want to help.
Yeah. So I would just tell someone, anybody who is looking into that, before getting it, do your research on the clinic that you're thinking about going to, and then be proactive in asking questions.
And also making sure you're doing all the things.
Yes. Yep.
It's not fun. Sometimes it is, but it's not sexy. It's not easy. It's the day-to-day grind that makes the difference. So
and I always call it your last line, or the last line of defense against it, but it should, doing the other things first, check the other boxes first before going down this route.
Because if that's what you need, it's life-changing. If you have a guy that's working out and he's eating well and he's got good relationships and he does try and get good sleep, and this is just the missing link, it's game-changing. They feel great, and that's the goal. The other, small caveat to that is you also have to check on their personal relationships and make sure that relationship is solid, because if I hop this dude up on testosterone and she's not ready for that, that can create some drama.
That's probably hard to ask about as I'm sure you can or do, but that's probably kind of harder to figure out as a doctor.
And that's where that trust in that relationship that you've built over time makes a big difference.
So that makes sense. All right. Well, I think that pretty much wraps up episode 3. All right. Thank you, Lindsay, for coming on.
Thanks for having me.
We will catch you guys next month, episode 4. Have a great rest of your month. And spring's almost here, gang. Even though, it doesn't really feel like winter has been here. It's about time to get into the sunny 75 weather. All right. Catch you next time.
Thanks so much for listening to the BFIT Blueprint podcast. If you would, please subscribe, like, comment, and share on Spotify, Apple, or YouTube, or whichever platform it is that you listen to the BFIT Blueprint podcast.